and suddenly you're having sex and it's like, I can't. I've seen the mild, the moderate, and the severe.
Hi, my name is Dr. Cathy. I am a board-certified family practice physician. My goal is to educate others about sex. So come with me and experience the world of sexual wellness.
Hello, it's me again, Dr. Cathy. Nice to see you today. I'm talking about painful sex. That's a big, serious, painful topic, right? Let's talk about the women. Let's start when you are young. The first time you have sex. Is it painful? You're the virgin. And suddenly, you are having sex for the first time. The hymen is going to be broken. That can be painful. So we all anticipate that first time. Remember that first time? Ouch. And you can see some spots of blood. Tells you how painful it is, right? But we get over it, and suddenly we don't have pain with sex. But some people do. And that's what we're talking about today. Something called vaginismus is another cause of pain, where the muscles of the vagina, for no explainable reason, hurt. They spasm, and suddenly you're having sex and it's like, I can't. I've seen the mild, the moderate, and the severe. Some people can't even put their finger in the vagina because of so much pain. So remember, every condition I list, you have to see a professional that deals with this condition so that you don't have problems forever, for the rest of your life. You have to make sure that you're being evaluated and checked. But these are real problems that you must address, okay? Vaginismus is that painful spasm of the internal muscles of the vagina. Let's say you don't have that, and you get an STD. You get gonorrhea, chlamydia, one of those STDs, even candidiasis, which is yeast, bacterial vaginosis, which is very common, not an STD, but suddenly your normal flora is out of balance, and what's happening? It hurts because you're rubbing that tissue that's inflamed. Get treated, and the pain should go away. So infections in general can climb up to the uterus, to the ovaries, to the tubes, and you're going to have that pain that hurts with deep thrusting. So you got to understand, if it's very deep, if it's going deeper into your lower abdomen, that means it's climbed, so it is much more serious. Fibroids, endometriosis can all cause pain during sex. Anatomically, your insides, which means your vagina, can also be an issue in terms of the shape. So there are different shapes of the vagina. Just be careful and make sure that you are evaluated to make sure that your internal shape is fine. And a GYN, a family doctor like myself, can check that out, okay? On the outside, you look at the shape of the vagina. Sometimes if you have, let's say, a childbirth and someone's done an episiotomy and you had a suture, you could also have some painful sex from that. So make sure that someone is evaluating the outside of your vagina. If you have an infection, let's say herpes, some sores, some warts, that can also cause painful sex. So please be aware and get tested and get treated. There are treatments for those. If we go into the psychological impact, if someone's been raped, right? If someone's had rough sex and psychologically they're turned off or they relive that experience, please remember there is counseling, there is psychiatric help to make sure that you are not having painful sex with your partner. Medications can also cause painful sex. You'll find that antidepressants, antihistamines, and sometimes even simple pain medications can make you have painful sex. So watch out. Your blood pressure medicines for that painful sex during intercourse. Okay, how do you know? When you stop the medication, which I don't recommend without some doctor's advice, your pain will go away, okay? So when you're having painful sex, please know there is hope and that you can actually improve painful sex as a woman. Now, as a man, can a man have painful sex? Absolutely. One of the most common reasons for a man to have painful sex, again, is an infection, gonorrhea, chlamydia. They're going to have that burning discomfort with ejaculation or with urination, right? I even see them sometimes ejaculate blood, okay? So that's telling me they've got to get treated with a strong antibiotic and the pain should go away. Another cause is the PGE inhibitors, we know as Viagra and Cialis. If they take too much of it, it can prolong that erection where they have something called priapism, okay? Priapism can damage the penis. You can get gangrene, so don't think it's cool to be having a prolonged erection forever. No, you've got to stop, get treated, go to the ER, they say, if it lasts more than 4 hours. We don't want an erection for more than 4 hours, okay? So that can cause painful sex for you, okay? The testicles, if it gets twisted, if it gets injured, you can have painful sex when the testicles are affected or traumatized. You can also have painful sex when your prostate's involved, okay? The prostate is something that stores your semen. It's an organ that stores your semen. And if you have an infection in there, or if there's something going on, something growing like a growth, you can have painful sex from that too, because it can block the passage of the semen through the different tubes within the genital system, okay? So just beware that men have painful sex too, and that you can and should be evaluated and get help for it to stop hurting so much, okay? So the most important one for both my men and women is the psychological one. You want to make sure you're with your partner and that you're with someone that you love and that you want to be with and you want to enjoy being with, okay? Psychologically, you want to make sure you're pairing up with your mate that will take care of you and treat you well and keep you safe and protect you in your relationships, each relationship you have, because sometimes women and men need to make sure that they are not either hurting someone or being hurt. You always have to make sure you're clear with your partner, okay? So painful sex is a very serious topic. Reach out to me, doctors like me, get some counseling, find out whether you're having any painful sex and whether there's a cause that needs to be treated. And if there is, we will help you take care of it, okay? Thanks for listening. Stay tuned for next week. We're going to talk about something regarding sexual wellness. Give me a call. Follow me on Facebook. Shoot me some questions. Subscribe. 770-632-6093. Thanks again for listening. Take care. Bye.